My name's Sarah. I'm going to be filming my sinus trigger. Come on over this way and I'll show you these panels we have here. It's set up for my patient, and I can switch hands that way. We're not going to use AEC. We'll be doing manual safety. This is how I can change between both KVP and mass. And then if we come over this way, I'm going to set up my room. For all sinus projections, you are going to want to be at 40 inches. So just going to bring it on over this way. Okay. And I'm going to crop. There it is. Okay, so now we've got it at 40. It's detented to the bucky, and got it that way, right, set horizontally to the wall. So now I'm going to go get my patient. Okay. Sky, come on in. Hi, I'm Sarah. I'm going to be taking your x-rays today. Hi. Can you tell me your full name and your birthday?
Yes, Sky Straub. It's May 9th, 1987.
Okay, and is there any chance of pregnancy at all?
No.
Okay. So why are we taking sinus x-rays today? What happened?
I fell, this is embarrassing, but I kind of fell on my face, and I've got a lot of swelling, and the doctor thinks that there's like fluid in my sinuses or something. And I can barely breathe, so.
Oh, I'm so sorry to hear that. Okay, so we'll be getting started. I just need to know if you've had anything else done to your face. Is there any history of trauma other than that?
No.
Okay, great. So I'm going to have you come take a seat here. And not too close to the board yet. I'm just going to adjust it a little bit. You can go ahead and sit down. So I'm first going to be doing the PA axial projection Caldwell method for Sky. And it's important to tilt the IR for this one. Since we are looking at air fluid levels, we don't want to be adjusting the tube or the way that I have my patient positioned. So I'm just going to change this here to 15 degrees. There we go. And then I'm going to be having my patient face the board, and I'm going to be having her match the angle of the board with her face. So Sky, go ahead and scoot on nice and close in, and I want your forehead and nose to be touching. Okay, I'm just going to raise this up. So for this projection, it's important to have your central ray exit the nasion. So I actually got it right the first time. Let me bring this down. I'm going to bring it right there. And then I'm going to have my there we go. I didn't mention this before, but it's also important to make sure that your patient doesn't have any sort of jewelry on, earrings or hairpins. Sky just has this little hair tie here, and there's no metal on it, so she is set and ready to go. And I'm just going to put her a little bit more this way. Her forehead and nose is touching the board. And my beam is exiting the nasion. The most important thing for me to point out now is that because the board is angled, her occipital meatal line is at a 15-degree angle to the board. So Sky would be ready to go. I'm just going to bring this shield on over in front of her and put my marker on. Right there in the corner. And I would be using a technique of about 85 kVp at about 7 mass. So Sky, I want you to hold your breath and don't move. Expose. Okay, so for this next one, what we're going to do is I'm going to have Sky scoot back for just a moment while I adjust this here. This is going to go back to the perpendicular. And for this one, what we want to do is make sure that Sky's occipital meatal line is at a 37 degree to the IR. So I'm going to have her go ahead and tilt your head back, and you're going to bring your face up to the board. I have to change the height here also. Okay, so now Sky, I just want, just so I can get you in a better position, tilt your head back for me, up there, and I'm going to have you scoot up until your chin's touching it. My board is going. Okay, so I've got our ventral line is perpendicular to the IR, and I've got my central ray is exiting at her campion. I'm going to move my marker back in here, and I'm going to collimate down a little bit. Because we're just getting her sinuses. All right, so for this one, I'm going to be using a technique of about 85 at 8 mass. It's pretty similar to the other one. I'm just going to, Sky, have you hold your breath? Expose. Okay. So now I'm going to be moving on to do my lateral projection. Sky, I'm going to have you turn and face me. This is going to be placing her right side against the board. And in an effort to reduce distance, we're going to have Sky in a RAO, and her head turned towards me. So Sky, I'm going to have you turn and then look at me, and then we'll scoot you in towards the board so your cheek's on it. I'm going to bring you back just a bit. This is a little bit too high. You want it to, you want your central ray to be horizontal and entering half an inch to an inch posterior to the outer campus. This is our outer campus here. So we are good. This is going to drop to that. We're going to come down to about there. Okay, there we go. So now we're nice and aligned there. We're going to marker on, right? You can see that I have her infraorbital meatal line. Parallel to the IR. And I'm just going to turn it that way just a little bit. So that should be nice and set. And we've got her goes her interpupillary line. That's interpupillary line is perpendicular to the board. Okay, so now we're ready to expose. I'm going to use a technique of about 85 at 4 mass. So Sky, I want you to hold still and hold your breath. Expose. All right, so for this next one, we're going to be doing the segmental vertical projection. Go ahead and turn around for me, Sky. There we go. So now I can keep using this marker because I'm going to still have marking her right side. But you want what you want your patient to do is hyperextend their neck here, looking up, and I'm going to have you lean back. This is going to cause her IOML to be parallel with the IR here, like this. And we're just going to send. But it's important to have your central ray entering about 3/4 of an inch from the external acoustic meatus. So I'm just, Sky's board is going to move a little bit here, okay? We're going to come on down. in between the angles of her mandible here. And collimation I'm pretty happy with. We're going to leave it like that. For this one, we're going to use the technique of about 85 to 14 mass. I'm going to put my another shield. That's moving. You cannot that move. Okay. Hold your breath. Expose. Okay, you can relax, guys. So that, those would be all the projections needed for the sinus exam.
So to begin, I will start by evaluating the PA axial projection, or the Caldwell method. And really just to start off as a blanket statement for all of the sinuses, you want to have your patient seated or standing upright, but they must be vertical in order to take an accurate assessment of air and fluid levels within the sinuses. So what I did with Sky was angle the Bucky 15 degrees so that her forehead and nose sort of had a natural position and just kind of lined up with that Bucky. So that's what I did. Placed her OML perpendicular to the IR still, and I kept my central ray horizontal, which is also really important when imaging the sinuses. Those are just kind of the key points for all of them in case I forget to mention them on other ones. For when you're evaluating the Caldwell image, you want to make sure that you, of course, have proper collimation, just like with any image. The frontal sinuses are lying above the frontonasal suture, and the anterior ethmoidal air cells are lying above the petrous ridges. There's no rotation or tilt, and I can tell that by just double checking that the lateral border of the skull and the lateral border of the orbits are equidistant, and the petrous ridges are symmetric on both sides of her head. And so the mid-sagittal plane is also, it was aligned with the long axis of my collimated field, and I can tell that by looking here at this image. So that's great. And then the 15 degrees that we put on the board cause the petrous ridges to be projected as lying in the lower third of the orbits. So this image looks great. This is the parieto-acanthial projection of the maxillary and sphenoidal sinuses. It's also known as the Waters method. Again, using that horizontal beam. We are looking to evaluate any potential air fluid levels. Of course, it's most important to see the maxillary sinus, and I can see that here on my image. The sphenoidal sinuses are projected through the open mouth, so you can also see the sphenoidal sinuses very clearly, and you can tell that I've properly collimated. And that Sky's orbital meatal line was positioned properly. It's important to hyperextend your patient's neck so that the petrous pyramids are shown lying immediately inferior to the floor of the maxillary sinuses. You know, those are clear for evaluation. And then to make sure that there's no rotation or tilt, you can evaluate that by making sure that there's equal distance between the lateral border of the skull and the lateral border of the orbits on both sides. Just, in my opinion, I don't know why that's one of the things you're supposed to look for. It's kind of hard to tell in this image where the edge of your the orbits are, and I don't know, they're just kind of barely on there in my mind. But the orbits in the maxillary sinuses are symmetric on each side, and the mid-sagittal plane of Sky's head was aligned with the long axis of my collimated field. And as far as brightness and contrast goes, it looks pretty sufficient to say that I think it's easy to say that I could evaluate for air fluid levels if there were any present. I would be able to see those there. So that pretty much wraps up the Waters method. The next image that I took of Sky was the lateral projection of the paranasal sinuses. This projection does show all 4 sinus groups. That's the main objective of this projection. They had proper collimation. You can see that the sphenoidal sinus is the best demonstrated out of all of them. There's no rotation or tilt of the sinus anatomy, and I can tell by looking to check that the cella-trisca is in profile, that the orbital roofs are superimposed, and that the mandibular rami are also superimposed, and it looks like the contrast and everything looks pretty good, and I would be easily able to see if there were any ear fluid levels, if there were any. So this image is sufficient. I am curious to know how many times when you're going through these triggers that you hear someone joke about it. It's as if I got this image from Merrill's. It's so good. So this is the submentovertical projection of the ethmoidal and sphenoidal sinuses. You can tell that it's properly collimated. You can see the sphenoid and ethmoidal sinuses very clearly. There's no tilt. I can determine that by checking that there's equal distance from the lateral border of Sky's skull to the mandibular condyles on both sides. Her infraorbital meatal line, her IOML, is positioned parallel to the IR. And I can see that my positioning was good by checking my image for the superimposition of the anterior frontal bone by the mental protuberance. And I can see that her neck was sufficiently hyperextended because the mandible has also superimposed with the ethmoidal sinuses. The mandibular condyles are anterior to the petrous pyramids, and yeah, the brightness and contrast looks good. I think I'd be able to assess air fluid levels if there were any present. So this image is also acceptable, and that wraps up my exam. Thanks.